The surgeons wished to admit the patient to ICU and operate the following day. And the question they asked was, how would you manage this situation? Now, here, the panel's trying to test a number of things. Clearly, the point here was, it's a sick patient who needs a laparotomy. Are you able to make your point that that's what's needed and not give in to surgeons who want to do the operation the next day? And they're kind of seeing if you can own the responsibility. Can you deal with it on your own or not? And do you provide them with a defensive answer? You can escalate it to the clinical director or medical director, but that has to be the last thing that you do after you've tried to resolve the issue yourself. Now, in going about answering a question like this, there are potentially a lot of things to discuss. So you would speak to the surgeon yourself, find out the reasons behind the decision to operate the next day, because as we all know, such a septic patient is probably better off going into theatre straight away with ongoing resuscitation, or maybe a bit of resuscitation prior to induction in the anesthetic room, rather than being left in ICU overnight, because more often than not, that's going to have a disastrous outcome. So being proactive in having those discussions directly one-to-one with the surgical consultant, if required, seeking a second opinion from somebody else in the organization. It could be the anesthetic consultant on call if you are the ICU consultant on call. Emphasizing the fact that this isn't a confrontation, but you're going to have to negotiate your way out of this. Try and influence it rather than simply escalate it higher up.